We're also going to be talking about cognitive action therapies this week. So as a reminder, behavioral therapies are a form of action therapies, but so is a cognitive approach. So the cognitive therapeutic approach is focused on recognizing distortions in thinking and replacing those distortions with more realistic, helpful thoughts. As a reminder, there can be irrational thought that can often accompany disorders, including magnification, where a single bad instance is seen as being reflective of one's entire reality, minimization, where good things tend to be underemphasized and seen as a fluke, overgeneralization, once again, this will always happen to me, I will always be a loser, and all or nothing thinking, where something is it must be perfect or might as well not do it. So these are just some examples of those irrational beliefs that can accompany psychological disorders that cognitive therapy attempts to address. There's a similar sort of pattern here to behavioral therapy, which is similar to all action therapies. There's no particular focus on underlying cause or origin of disorder, but simply treating and managing and coping with symptoms. So CBT is the most well-known cognitive therapy, cognitive behavioral therapy. So it's an action therapy where people learn to think more rationally and logically and to recognize and redirect maladaptive thought. So for example, someone who's suffering from schizophrenia might learn how to recognize when they're experiencing a hallucination and redirect to say, this is not real, and to redirect to another thought. Someone who's experiencing OCD might learn to recognize unwanted intrusive thoughts and redirect those thoughts. Someone who's depressed might learn to recognize negative thoughts and redirect them. There are three main goals: to relieve the symptoms and solve the problems, to develop strategies for solving future problems, and to help change irrational and distorted thinking. Those most likely to benefit from cognitive behavioral therapy are folks who are having challenges with depression, stress disorders, and anxiety. EMDR is another action therapy known as eye movement desensitization and reprocessing. This is a process through which people are exposed to distressing thoughts and images while engaging in side-to-side eye movement and hand tapping as a way to disassociate with those particular distressing thoughts and images. It's been shown to reduce stress and reduce avoidance, which can once again be reinforcing to the source of the fear, and has been found to be an effective treatment for PTSD and for certain anxiety disorders as well. Mindfulness training is another approach used in the cognitive therapy sort of basket. And with mindfulness training, it involves meditation and deep breathing. This is usually a chance for people to maintain their present, so to focus on their present state and to not think about or worry about their future. And when people start thinking about negative thoughts or their future, then the goal is to redirect to the present and to focus on breathing. This is thought to help improve people's anxiety and stress management so that folks have better coping mechanisms when it comes to dealing with stress and anxiety, as well as negative thought patterns that can occur. And likewise, when people have entered a state of mindfulness and have training in mindfulness, they can find certain stimuli to be less fear-inducing and traumatizing. It provides a bit more of a buffer so that those things are a little bit more manageable from a distance.